But our next presenter is Dr. Harpal Mangat. Mr. Mangat went to medical school at the Royal College of Surgeons in Ireland, interned at Trinity College, Dublin, and then completed residencies at London and Oxford universities before arriving in the U.S. in 1992, where he did the same again. He is currently in private practice in Germantown and has treated over 1,000 COVID-positive patients with good results. Mr. Mangat, or Dr. Mangat.
Thank you very much. First of all, I'd like to compliment you on what you said. I've been through the same here in Maryland, and it's horrific. But what you can do is just...
Doctor, get your mic right about 3 inches from your...
Okay. I want to thank you for sharing your experiences. I've had the same experiences. I'm currently a COVID center, and a lot of people call me up for everything, and it's evolved. You have to pick up the challenge and help the patient. And the most important thing is seeing how it has evolved. When we started, we didn't understand this disease. And what I've learned from it, it's a two-step disease. The first step is the early phase, the viral phase, and there are generic antivirals which aren't as expensive as Malone or the other drug, which can be used. But the whole point is after you have day 7 to 10, you enter the immune or the inflammatory response. And the only way to treat it is high-dose steroids. And we've got to be careful as physicians, because one of the problems that Pierre Kory was saying, and other people have been saying, all these papers came out, well, they were essentially treating the inflammatory phase with the wrong drugs. So you've got to look critically at some of these papers and understand that. So, but what I want to do is just thank my patients for allowing me to, well, for pushing me, because they refused to go to hospital, like your patients. And I had to figure out, well, how do I treat this obese diabetic and keep him alive? And it worked. And each time we had to bring them in, and now I'm giving IV antibiotics, IV steroids as well. And I'm having very good results. I'm having the same experiences that you did with the hospitals. So it's not just you, it's all of us. But I want to thank you for the comments you made, because I think a lot of us are in the same position as we try and help our patients get better every day.
Thank you, Doctor. Our next presenter is Dr. Paul Marik. Dr. Marik received his medical degree from the University of Witwatersrand, Johannesburg, South Africa. He is board certified in internal medicine, critical care medicine, neurocritical care, and nutrition science. Dr. Marik was professor of medicine and chief of pulmonary and critical care medicine, Eastern Virginia Medical School in Norfolk, Virginia. He has written over 500 peer-reviewed journal articles, 80 book chapters, and authored 4 critical care books, and has been cited over 48,000 times in peer-reviewed publications. And Dr. Marik is certainly one of those doctors who've been persecuted for treating patients.